the same doctors that were wrong about everything related to COVID-19, from lockdowns to school closures to universal masking and the thingy, are now thinking that they have all the solutions for this epidemic of gender dysphoria that's impacting hundreds of thousands of children throughout the world. And we're going to talk about whether or not this is a social contagion, or in fact, we're just better at diagnosing gender dysphoria, and separate out the activism from the actual facts and talk about the history. And the reason why I'm personally interested in this, of course, this is not a topic that we normally talk about, but I think there's a lot of interesting parallels with the origins of gender identity from John Money. And this was a scientist from New Zealand, actually, that studied at Johns Hopkins, but he did get his psychological degree over at Harvard. There's some interesting connections between the origins of the demonization of fats and the association with gender identity when it comes to Ancel Keys and how he behaved. And of course, many of you know how Ancel Keys was responsible for helping to create this several decade-long demonization of fats and say that it's really fats that are causing heart disease. And now we know it's probably sugar and lack of exercise and all these other things. Well, Dr. John Money has interesting personality attributes that are quite similar to Ancel Keys. And I think that's important to recognize. And so he was the one that coined the term gender identity that is now responsible for influencing this social contagion that is causing 11-year-olds to go on puberty blockers and causing psychologists and doctors to rapidly affirm child's genders. And that is linked with, of course, all sorts of systemic health issues and infertility and sterilization and lifelong sexual dysfunction. And so I think this is important for that reason. The second reason is understanding this whole gender dysphoria situation and the hormonal changes that are linked with gender affirming care, how that changes body composition. And so that really helps us to understand the importance that hormones have and play when it comes to body composition, because unbeknownst to me, I was not aware that trans women, these are biologic males that transition into women, they're injecting synthetic estrogens at as early as age 11. I'm sure there's cases of trans women doing this earlier than that, but that changes body composition. It is associated with a reduction in lean mass, changes unfavorably, of course, in metabolic health and long-term complications when it comes to disease risk and also sexual function. And the inverse is also true for trans men. These are biologic women that make the hormonal conversion and social transition into a man. Their risk for cardiovascular disease and urinary tract issues like incontinence and also cardiovascular disease risk goes up. So there's a lot of reasons why I want to just go into the history here, spend a few minutes talking about that and what the actual evidence suggests and also what different countries are doing. You know, for example, the media really demonized Sweden for a long time when it came to COVID-19. And I remember in April of 2020 and May of 2020, the media could not stop talking about how silly the public health experts were in Sweden for keeping schools open, primary schools, letting kids go to school, not doing lockdowns. But now we know the age-adjusted mortality rate from COVID-19 is quite low in Sweden, especially when compared to here in the US, where we kept schools closed in some states for 2 years, right? Kids in California and here in Washington were doing Zoom school in this or masking in school. Meanwhile, Sweden achieved herd immunity much faster. Well, it turns out that Sweden is taking a drastically different course when it comes to the rapid onset gender dysphoria diagnosis and treatment. Here in the US, basically your child can watch a few TikTok videos or Instagram videos. And if you look at different hashtags, I'm blown away. I have a daughter who will be 11. So this is actually maybe a little bit more close to home in terms of me wanting to know more about this and see early signs of potential gender dysphoria in my daughter and potentially her friends, because it turns out the studies show that biologic females that seek gender dysphoric care and suffer from that have on average 2.4 friends that are also in the same boat. And so it seems that this is very socially contagious compared to biologic boys. And there is a strong co-occurrence with the onset of puberty blockers as kind of the first line therapy for children after they see a psychologist. Then they go to a gender affirming specialist like a doctor. 96% of the children that go on puberty blockers end up going on hormones. whereas about 98% of the children that do not get puberty blockers end up just fine and they work through their gender dysphoria. And it turns out that we may be medically treating gender dysphoria as a condition when children really have angst associated with puberty. And I just want to say thank you for being here. Thanks as always for hitting that like button, leaving me a comment below, and sharing this video as a direct text message with a friend that you care about to help them optimize their cardiovascular health. Because we know that erectile dysfunction is a sign of early cardiovascular disease. So if you're experiencing this, this is a symptom of a much larger problem. And you need to share this with your friends and family so that they can change their lifestyle and their diet and so forth. We've talked a lot about metabolic health before. One tool that can help support metabolic health is berberine hydrochloride, known as the berberine fasting accelerator by Biologic. This very unique combination of synergistic nutrients, not just berberine hydrochloride, but also alpha-lipoic acid and biotin, can be used to help kickstart your fast and help optimize and support and maintain a healthy cardiometabolic health. You can take 2 to 3 capsules during or after your last meal to help curb some of those evening food cravings and help support metabolic health. Because you know that metabolic health is intimately connected and inextricably linked with cardiovascular disease. So if you have metabolic dysfunction, you're probably going to be more prone to having cardiometabolic health issues. And so we want to help you optimize that. And that's why we formulated the berberine fasting accelerator. I'll put links below, my friends. It's a great tool to kickstart your fast and curb those evening food cravings. You can save using the code podcast over at myoscience.com. That's myoscience with an X, MYOXCIENCE.com. The evidence doesn't corroborate with the activism enthusiasm. You know, a lot of activists are telling parents, well, if you don't rapidly transition socially and hormonally and also with gender reassignment surgery, you will have a dead child. And that is just not a good mindset to go into. And there's actually not good evidence to suggest that that statement or that theory is actually based on sound evidence. And I want to just dive into this because I think most of us have either been impacted directly with friends or family who have had children who are transitioning, or we've seen this out in public. The grocery store that I've been going to for over 20 years in Seattle, the Central Co-op there, I would say half of the cashiers are non-binary. And many of these people, and this might sound like a critique, they're still wearing masks and gloves in grocery stores. You know, I mean, this is 2023. Many of us have gotten COVID. Presumably these people have been vaccinated and boosted, yet they're still wearing masks and wearing gloves while they're at work. And so I think there's just a lot of co-occurrence with cognitive biases as it relates to politics that are skewing people's perceptions about how we should medically manage these children. And I think it's important to recognize these parallels because, as many historians have talked about before, if you don't know your history, you're failed to repeat the history. And so if we think about the history of fat and how did fat get demonized by the medical community, and how did this almost myopic focus of LDL cholesterol come about? Well, it really came about from this researcher known as Ansel Keys. Many of you know about this. We've interviewed Nina Teicholz on our podcast, and she talks about the history here of the 7-country study and all this. So Ansel Keys has a lot of professional behavioral characteristics that are similar to Dr. John Money, and meaning that in professional meetings, anyone who would critique his theories and his ideas, he would publicly demonize them and get up and shout and be very loud and boisterous and intimidate people and use these different tactics to influence other professionals to go along with his theories. Well, Dr. John Money was very similar. And again, this is important to recognize that Dr. John Money was the inventor of the idea of gender identity. And he coined the term in the 1960s. And essentially, Dr. John Money, he's a psychologist. Again, he received training from Harvard. He went on to create this gender identity clinic at Johns Hopkins, which was since been closed. So Dr. John Money grew up in New Zealand, and he was abused by his father, who subsequently died when Dr. Money was quite young, about 12 years old. And so Dr. John Money was known to be a little bit socially awkward, not very athletic, and had a hard time socializing, according to records. And then he was raised by his feminist sisters, and he had a thing against masculinity and men in general. And so that was sort of his bias going into his profession. And he's been quoted to say, life in the world might be better if men were castrated. And in addition to his anti-masculine sentiments, Dr. Money believed that all human beings are born with a gender blank slate. And it's societal and cultural influences that ultimately determine one's gender. And he did a lot of work clinically at Johns Hopkins and presumably other research centers and collaborative of research on hermaphrodites and individuals who had sort of ambiguous genitals. And so that was his primary entry point into gender identity. Then came along Bruce Reimer. And so I highly recommend you read this book, As Nature Made Him. Phenomenal story about Dr. Money, the ideology and the formation of this gender identity phenomenon that we're experiencing. And the reason why this is important is because this family, the Reimer family, had twin boys. One of the boys had frequent urinary tract infections, and the parents thought that if they could just circumcise the boys, that would go away. But a problem happened with baby Bruce. Baby Bruce, he was getting his penis circumcised. He was just 6 months old, and the physician at the time, who normally does these procedures, happened to be not at the surgical center at that time. And he used a different instrument, which actually fried baby Bruce's penis, and it caused his penis to be then amputated. And that caused the parents, of course, a lot of psychological distress. They were concerned about at the time, well, we can't go out to dinner and get a babysitter. What if other kids find out about this? They were just concerned about, as any parent would, about their baby boy and how to raise this boy, especially because his twin brother had a normally functioning penis, because after the botched procedure, the surgeons called off the other procedure. So the family was really distraught over this and wasn't sure what to do. They went to Mayo Clinic and they saw this relatively alluring commercial where Dr. Money was talking about gender. And I guess he was a very gregarious guy, very good on camera, seemed very witty and intelligent. And so the Reimers became very interested in meeting this Dr. John Money. They went to go visit him and had the boys treated by him, specifically Bruce, to raise him as a girl per Dr. John Money. Dr. Money said, hey, look, gender, it's all based on society. It's based on influences. If you just start to raise Bruce and change his name into a girl's name, give him dresses and Barbie dolls and the like, he will be a happy, healthy girl. We can transition his genitals and form a vagina and give him hormones and the like, okay? So that's what happened. But it turns out that Bruce was never really happy as a girl. He was known to be aggressive. He was known to not really form so strong social connections with his peers. He always urinated standing up. And so that was really peculiar for the family. But Dr. Money ignored it. And it turned out that over the course of treatments, the family would come down from Winnipeg to Baltimore, Johns Hopkins, and see Dr. Money. And he would sexually assault them and have the boys take off their clothing and behind closed doors and do some really strange stuff. And that really speaks to Dr. Money's sort of bias here. He was known to go to sex parties and have polyamorous relationships. He never had children. He had heterosexual and homosexual relationships. Not that that's bad, but you just need to understand his biases. So as you can imagine, Dr. Money had a lot of personal and professional investment in seeing this experiment become a success. He became well known for his theories. A lot of people started to believe the idea that humans are born gender neutral, as a gender blank slate. The only downside here is the family did not want to continue treatment with Dr. Money because the kids were getting sexually abused, and baby Bruce, who had changed his name and had socially and hormonally transitioned to a girl, was unhappy. So unhappy that his mom finally had to come clean with him when he was 16 and tell him that he is actually a boy. And this is where he changed his name back to David. He said, screw this. I was never happy as a young girl. I always knew I was a boy. It felt really weird. And he then, created a new life for himself. He got married. He eventually had children. I don't know logistically how that even happened, but he had children, got married, and had 3 children. And he eventually told his story. And his story completely contradicts all of Dr. Money's professional research. And that's what's really important. And that's why I wanted to spend a few minutes elaborating on that, because here you have a professional that has influenced a lot of other medical professionals on this idea that actually turned out to be a failed experiment. And it's a really sad story because David's brother ended up committing suicide or overdosing on drugs. And then David eventually committed suicide. There's been a lot of videos about David Reimer. And so this failed experiment totally transformed the entire ideology of medicine that is now the basis of gender affirming care, which is not based upon sound science. So I want to get into that science. And I think that historical perspective is important because for months and years all throughout COVID, we heard about we have to protect the children. We have to mask the children. We have to close the schools. We have to do all these things. And here we are prescribing puberty blockers to 11-year-olds. And we're having these consensus statement papers come out. And we're scaring parents into not medically transitioning and socially transitioning their children for fear that they will commit suicide. The challenge here is, and this is my whole point, no one really cares what grown adults do. If you're 18, 20 years old, you've been frustrated that you feel like you're in the wrong body, by all means, do what you need to do to be happy, to be healthy, whatever it is. You want to get a double mastectomy if you're 21, by all means, go for it. Women do all sorts of breast augmentation as adults, and that's their own personal choice. But children do not get a driver's license at 11 years old because we know that their brain is not fully developed. Puberty is a very important neurologic stage for cognitive development, improving impulse control, and the like. And so that's why we do not let children drive cars until they're 16 years old. That's why we do not let children get tattoos until they're 18, or smoke cigarettes, or drink alcohol, or fill in the blank. You don't see children getting their pilot's license because we know their brains are not developed, but we're allowing children to take hormones and puberty blockers at 11 because of a social contagion. I really think we need to think this through. And that's why I'm making this video. And we need to talk about what Sweden is doing and what a recent study has actually found. So let's dive into this study here. Rapid onset gender dysphoria, parent reports of 1,655 possible cases. This was just published in the journal Archives of Sexual Behavior. And essentially what this study found is there is a gender difference between biologic females and biologic males at the age of onset, and the prevalence of young females versus young men going to clinics experiencing rapid onset gender dysphoria. So you can look here at the percentage of the age of onset. You see in young females, it's around 12 and 13. And there's a dramatic differences in the age. And so it might be that children now are experiencing puberty much earlier than they were in prior years because of poor metabolic health issues. Sean Stevenson has done a lot of research and talked about that, and that has been published. During COVID-19, circadian rhythm disruption, sleep issues, unhealthy eating behaviors have created metabolic challenges and mental health issues that have caused young girls to experience puberty much earlier than historically has seen. And Jordan Peterson and other people have talked about how puberty is a time of more mental angst and anxiety. I remember as a child going through puberty, you wake up with an erection, you have more body hair where you didn't have it before, you get more insecure about your body and comparing yourself to other kids. I mean, there's a lot of comparisons, a lot of things going on, and it's been long known that it is a period in one's life where there's a lot of anxiety. And so we shouldn't be surprised that more children are anxious during this time. And it seems that we're medicalizing this anxiety with the wrong treatment. We're not looking at the root cause. We're not looking at metabolic health or mental health or nutrition, vitamin D status. One paper showed that vitamin D insufficiency was prevalent in about 80% of individuals that suffer from gender dysphoria. So I'm not saying that some of these kids don't have true gender dysphoria, but I think we need to disentangle the true gender dysphoria from the social contagion of rapid onset gender dysphoria. So the scientists offer two hypotheses to help explain this sudden rise in gender dysphoria. They say hypothesis one is that we're better at recognizing and diagnosing it. So that's number one. A lot of activists say we're now recognizing it. It's now socially acceptable to transition. We have the tools. Why not do it? Hypothesis number two suggests that this is a social contagion. And they say that the condition known as rapid onset gender dysphoria leads children to falsely believe that they are transgender and that they must undergo social and medical gender transition to resolve their issues. A sharp increase in such false beliefs among adolescents and young adults has led to the recent increase in gender dysphoria. And this is believed to be a cultural bound syndrome, which did not exist until recently when transgender issues began to attract considerable cultural attention. Furthermore, rapid onset gender dysphoria has been hypothesized to be socially contagious. Adolescents who know other rapid onset gender dysphoria children are more likely to acquire rapid onset gender dysphoria themselves. Advocates of the rapid onset gender dysphoria are more likely to acquire rapid onset gender dysphoria themselves. Advocates of the ROGD theory view the dramatic increase in the referrals to gender clinics with alarm. They are concerned that adolescents with ROGD, again, rapid onset gender dysphoria, are at increased risk for unnecessary, harmful, and irreversible psychological and medical interventions. So what's unique about this study is they also looked at mental health and mental health history and compared that between young women and young men. So when the researchers asked the parents whether or not the gender dysphoric youth had a history of mental health illness, 57% of the informants responded affirmatively and 42% negatively. 0.4% did not respond. The percentage of affirmed responses was slightly higher for natal females, 59%, compared to natal males, 51%. Now here's what's really interesting. The correlates of social and medical transition when it comes to the friends and the family members and all this. Socially transitioned youth were more likely to be natal female. They tended to be older. About 72.7% of females were 16 or older, compared to just 60% of those younger than 16. For males, the respective figures were 31% and 21.3%. So let's pause right there. We have more than twofold the number of young females compared to young men that want to transition. So that would lead one to sort of have a little bit of not so much credence for this idea that we're all gender neutral. Because if we're all gender neutral, we would think it'd be roughly even distribution between the number of females that are seeking help for rapid onset gender dysphoria compared to the young males. But it's about 2.5 times the prevalence in young females compared to young males. And that has to do with probably social media, how young females communicate with each other, how women are more likely to talk and talk about their feelings and so forth, and glorify things on social media, such as transitioning and all of this. Okay. The scientists say that young females tended to have gender dysphoria longer. They found that females who had been gender dysphoric for longer than 1 year had a 75.5% rate of social transition compared to just 58% of those gender dysphoric for 1 year or less. And for the males, respective figures were just 45% and 22%. So again, it's about half the prevalence comparing young females to young males. They tended to have a history of mental health issues. 74.1% of females with both a history of mental health issues and a formal diagnosis had socially transitioned, compared to just 57% of those with neither for males. And so I think that's important. Again, 74.1% of females with both a history of mental health issues and a formal diagnosis had socially transitioned. And again, I think this is really important because the steps are social transition, like you go to school, Sally is now Ben or Sally is now Bob, and the teachers refer to Sally as Bob. Then the next step is Sally would go on a puberty blocker, a GnRH inhibitor. Usually that's injected, and people come back to the clinic and they get frequent injections. So we're blocking puberty. Then now Bob would get testosterone, and then probably a double mastectomy and potentially bottom surgery. So they refer to top surgery and bottom surgery. Also, the book Irreversible Damage by Gabrielle Schreier goes into all of this. I've read that as well. Phenomenal read. So you understand the impact of this social contagion and what the medical system is doing to children. It's just horrific. Now, here's what's important to recognize is, again, what people say, the activists say, is if you do not socially and medically transition your child, you will have a dead child. But here's what the evidence actually shows in this paper of 1,600 families. What they find is that the social transition was actually linked with worse changes in mental health. And so what you see here is this is figure 3. So again, this doesn't corroborate with what the activists say. Once children socially transition, their mental health does not improve. In fact, most of it, either it's much worse or somewhat worse. In fact, in a small percentage of cases, it's somewhat better. And in like this teeny little bit, it's much better. So again, this theory that the activists are foisting onto children and scaring parents into rapidly acting on both the social level and also the medicalization level is not corroborated by the evidence. And in fact, what is going on in other countries? Sweden is recognizing this. The Nordic countries are recognizing this, as is the UK. And they are not rapidly affirming children medically, right? It's one thing socially, okay, Sally, you want to go as Bob, okay, fine. But in very extreme circumstances, is the healthcare system in Sweden medically transitioning children, giving them puberty blockers, giving them hormones, and then giving them surgery. This is happening here in the US. In fact, the legislation is set up for various pediatric organizations and psychological foundations that if doctors do not rapidly affirm the gender, they can be penalized by their governing bodies that issue their licensure, which is just insane. So again, let's just take a step back. Let's take all the politics and the emotion out of it and just think big picture. Who functioned best during COVID-19, right? This was a new virus. We didn't know all these things. Sweden took you could say a brazen approach, but a more common sense approach. They say, hey, look, we know from the data right now, this virus is not impacting children. It's disproportionately impacting the elderly. So we don't want to harm the children for a disease that doesn't even impact them. So they left the primary schools open. They didn't do mandatory masking or lockdowns. They fared way better long-term compared to what do we do here in the US. We ignored all the data that showed that COVID-19 didn't impact children. We harmed children. Now we see rates of suicide and mental health issue are on the rise. And then we see a dramatic surge in the onset of rapid onset gender dysphoria. And what are we doing? We're quickly medicalizing this. And we need to recognize, my friends, that this is having lifelong potential consequences, especially when it comes to sexual dysfunction. In fact, I'll link a recent podcast and show it somewhere on the screen here of an interview from a clinic manager of a gender affirming care clinic in the Midwest. She worked there for about about 4 years. She's a lesbian married actually to a transgender male, right? So she admits that she's very liberal, but she quit working at this clinic because what she saw happening to children was just damning.
One of the things we were starting to see was that some of the kids put on the puberty blockers, mental health was getting worse once they started the blocker. And that's against what the narrative tells us. The narrative says these interventions are supposed to make people better. And what we were seeing was parents calling and saying, my child has had the blocker in for a month. They're crying every day.
And she recognized that many of the people and the doctors at the clinic, they didn't have children themselves. They were thinly disguised activists, and they were not operating. In fact, if you questioned that the child was not doing good after puberty blockers and hormones, you were at risk of being fired, she said, because this was all about ideology. This was all about political activism, and this was not about the actual care and the mental health of children, which she saw decline. These children, as they get on these puberty blockers and hormones, they have lifelong potential sexual dysfunction. Some of these young boys, let's say they decide later they don't want to be a girl, their testicles never fully develop and their penis might be the size of when they were 6 or 7 years old, right? I mean, this is, again, we don't let kids drive cars or airplanes or boats because their brain is not developed, but we're letting them transition their sexual organs when their brain is still undeveloped, and we're preventing the full development of their brain by giving them puberty blockers. This is absolute insanity. And what's even more scary is social media platforms are censoring people for talking about it. It's just like COVID-19. This is why history is so important, why many people have talked about COVID, why when we talk about fat, when we talk about cancer, we need to look at the history of all these things because they have similar origins. As I talked about, Dr. John Money, it was very similar in terms of his public and professional presentation compared to Ansel Keys. And Ansel Keys was wrong. Dr. John Money was clearly wrong. And let's finish up here and then we'll talk about what exactly Sweden is doing and how the famous Dutch study that many of the activists reference and say, see, this study found that if you don't socially and medically transition your child's going to die. Well, in the inclusion criteria for the Dutch study, they prevented people from being enrolled in the study if they had a history of mental health issues. And as you just heard, about 74% of the young girls that seek gender affirming care have a history of mental health issues. So that study does not apply. These are different cohorts that we're talking about. And again, this doesn't get conveyed to people and parents, and they get scared and they do what the doctor said. In fact, if one spouse disagrees with the other spouse and this goes to court, the courts will often favor the parent that is seeking gender transition. And there's been many unfortunate situations of parents who have lost custody of their child for fighting for slowing down the medicalization of their gender onset, dysphoria. And so that is terrifying. I mean, as a father of a child, to know that if my child was influenced by social media that we're going to talk about here, that is just astounding. If she was influenced by that and then had the belief that she is now a man, and then, her mom wanted to give her hormones and blockers, and I disagreed with that, the courts would favor that child's perception over my own years of observing the child. I mean, this is a thing that I think is quite interesting. And these activists, they do not have children. Anyone who has a child knows that young boys are completely different from young girls. And this is not the influence of culture or socialization. This is just innate. So the scientists say, asked whether the youths had friends or others who came out as transgender around that same time, 54% of the parents said yes. That respondent was significantly higher among natal females, 60% compared to just 38% of the males. Among those who answered yes, the mean number of transgender friends was 2.4. Okay, having friends who came out as transgender was sufficiently related to the likelihood of social transition, statistically adjusting for natal sex. Among females, 73% with contemporaneous transgender friends had taken steps towards social transition, compared with just 54% of such friends for males. And so again, the ratio is about 2 to 1. So most young females, natal females who are transitioning to boys, have other friends who are transitioning, and they're influenced by those friends. Now, any parent knows this, and you were taught this by your parents when you're young. If you're hanging out with kids who are doing drugs, you're more likely to do drugs. If you're hanging out with kids who are doing sports, you're more likely to play sports. So if all your friends are transgender, then obviously you might start to believe that you yourself are also transgender. And this is the social contagion effect. So I wanted to share this with you. There's been a lot of, this is very controversial, obviously, but parents need to be aware of the fact that Instagram hashtags such as trans care, top surgery, bottom surgery, chest binding, breast binding, all of these things are being utilized by young children who are on social media. So I would strongly suggest as a parent, a good strategy is to not allow your child to have a smartphone. As you can see here, there's also the trends in Google and in other media sources and so forth that have looked at the onset of gender dysphoria. It coincides with smartphone and social media applications starting in 2013. So what happened around 2012? Instagram came out. We saw Snapchat was a big one in 2013, 2014. And then now we have TikTok, right? And so the more young people that are getting on these platforms, seeing pictures of other people who have undergone breast binding, top surgery, puberty blockers and the like, and they are unaware of the long-term health consequences. When you were 11 or 13, you were not thinking about how many children you want or your future. You were just thinking about, how do I have more friends in school and get more popular, right? And it's more short-term gratification. So why then in this country are we rapidly medicalizing gender dysphoria and not looking at the root cause, not looking at exercise, nutrition, sleep, circadian rhythm dysfunction, micronutrient imbalances, metabolic health? A vast majority of these children who have rapid onset gender dysphoria also use illicit substances, whether it's marijuana or kratom, who knows what the substances are, but surveys have actually found this. And a clinic in San Francisco recently reported that children have identified as 48 different genders, right? And so you got to ask yourself, how did they learn of these things? It's most likely through social media and activists that are also targeting children. And so this is not anti-gay. My grandfather was gay. Great person, spent a lot of time with him, loved him dearly. Unfortunately, he passed away from macular degeneration. My cousin, gay, no problem. A lot of friends that are gay. This is not an anti-gay message. This is that we should protect the children. And that's why we don't allow children to get tattoos, drive cars, drive boats and airplanes, smoke cigarettes, because they do not think forwardly. They're thinking short-term, immediate gratification and are known to be impulsive. And the medical community is exploiting that. So I think it's important that we recognize this, that we get educated on this, and we all start to talk more about this, because this is a phenomenon that is not going away. It is only increasing. It's being politicized, and the long-term health consequences of giving a young boy estrogen, think about that, what that could be doing for cardiometabolic health, for cancer risk, because the estrogens that are being injected into young boys are synthetic estrogens and progesterones. And we know that these compounds affect the brain in females that are taking birth control, but the young boys are taking significantly more higher levels of these compounds, and they're developing breasts and the like. And I just worry about the future health of people. I care about children, and I made a lot of dumb decisions when I was a child. I'm sure you did as well. And I'm so glad that this wasn't around when I was a kid, because it seems like the pressure is everywhere, from drag queen story hour in school to all these different things, and they're being foisted on children. And the children are our future, and we should care about our future. So hopefully you found this helpful, and the show notes helpful, and all the resources linked below. If you want us to do more content on this, and I think it's quite interesting just looking at the body compositional changes with hormones, but we should be aware of the long-term health ramifications, and most importantly, follow what other countries are doing. Look at what Sweden's doing, Nordic countries. In the UK, they have a completely different, more holistic approach compared to what we're doing here in the US. And I think we should follow that more conservative medical model. So thanks as always for tuning in. We'll catch you on a future video down the road.